This is DW News Africa. How fast can a virus outrun the response to stop it? In eastern DRC, the answer is faster than anyone predicted. The Ebola outbreak, the worst on record, has now killed more than 1,000 people in just 2 months, with the WHO warning most new cases can't even be traced back to their source. And the fear isn't confined to Congo. Activists in Kenya say a US-backed facility built to quarantine exposed Americans risks bringing the virus in, not keeping it out. And they insist authorities are defying a court order to stop it. I'm Michael Okwu. Welcome to the program. It's been 2 months since the WHO told the world the bad news. Ebola had broken out again in the Democratic Republic of the Congo. And now the latest tragedy. More than 1,000 people have died in this outbreak alone. This time it's killing people at a faster rate than ever before. In West Africa, from 2013 to 2016, considered the worst outbreak on record, the buildup was much slower. It took about 8 months to reach 1,000 deaths. And the weekly increase has been rising over time. Especially in July, there have been some big jumps, putting this current outbreak on track to become the worst Africa has ever seen. The killer disease has been spreading undetected and rapidly out of sight of the health professionals who are battling to stop the virus.
Medical staff here are on the front line. Mongvalo in Ituri is the Ebola epicenter. They have been working without adequate support, but their commitment remains unwavering. Grace Kakure has been a nurse here for 5 years. Aged 27, she was confronted by Ebola from the very start. It was declared late and the hospital was under-equipped. Grace saw 5 of her colleagues die from the disease, all infected at their workplace. Despite the grief, she stayed.
At the beginning, the epidemic was spreading quietly. The official declaration came after we had already been in contact with patients. What contributed to the infections was our dedication and our care for the sick, because all of those infected were healthcare workers. Even though we lost nurses from this hospital, we've remained resilient. Because if we don't keep going, we'll be sacrificing the lives of others.
Fear of Ebola has even robbed the sick of healthcare. 20 people used to come to the hospital every day, but once the outbreak was declared, they stayed away, fearful that it was the source of the sickening.
After the epidemic arrived here, we noticed some people refusing to come to the hospital, claiming that the epidemic was in the hospital itself. Nevertheless, in recent days, we've seen a slight increase in attendance. People are coming from other areas to receive treatment here. We've got used to it. This is the profession we chose.
About 20 doctors and nurses have already died after contracting Ebola in Ituri province alone. Those who remain feel left behind. Many are not being paid properly. Some died without officially being recognized as public employees in DRC.
This is not a good situation. What we ask of the government is firstly to include us among those who receive hazard pay. Secondly, to remember Mongvalo. Mongvalo has been forgotten by everyone for a very long time.
Despite logistical and financial challenges, the fight against Ebola is continuing on the ground thanks to people like Grace Kakure, who remain committed to serving their community.
To give us some real perspective on this outbreak, Dr. Jean Kaseya joins me, Director General, Africa CDC. Welcome, Dr. Kaseya.
Thank you for having me.
Our pleasure. This is now the fastest Ebola outbreak Africa has ever seen. Why is it proving so persistent? In other words, what's driving the fact that Ebola itself, as you've put it, is now moving faster than the response?
Yes, there are a number of factors that can explain that. The first one is the humanitarian context. You know, we have more than 1,150,000 people living in camps. And these people, for a very long time, they didn't have assistance. And now, when we are coming to talk to them, the second reason coming from that is the mistrust, because they believe that we are just coming because we are afraid of Ebola, and we are not coming to help them. The third reason is insecurity. We are living in a region where rebels are operating. Even my colleagues from Africa CDC who went to a place called Nyakunde were attacked by rebels. The fourth reason is lack of medicine, approved medicine and vaccine. I think all of these reasons combined with the weakness of the health system are explaining this quick spread of the outbreak.
This outbreak is caused by the Bundibugyo strain, for which there is still no approved vaccine. How does that affect your strategy in fighting Ebola? And are there any promising candidate vaccines or therapies that could realistically make a difference?
I think now more than 1,000 deaths is pushing us to rethink about what we need to do. But what is clear is, while we are moving with the clinical trials of medicines and vaccine, and I want to remind you that the clinical trials started a few weeks ago, we are also insisting on what we call the public health measures. And we need for that to rebuild trust with communities. We need them to accept first what we call the dignified and safe barrier. They cannot touch bodies. They have to leave. People who are trained to do that. Second, they have to accept to come to health centers anytime they have symptoms to be tested and to accept to be isolated. And we need them also to be involved on the program, sensitizing communities for this outbreak and to accept that the disease is real. I think these are a number of strategies that we are putting in place to stop this outbreak.
One of the dire challenges is clearly contact tracing. The WHO says 4 in 5 new cases have no known chain of transmission. 4 in 5. To be clear, that means the virus is spreading where health officials are not looking or can't even see. In simple terms, what are the implications of that, and what, if anything, is being done to fix it? I assume this has a lot to do with the fact that this virus is happening in a conflict zone.
You know, when I started to talk about the contact tracing issue, some people were shocked. Just to give the clear information on what is going on, when we have more than 2,600 cases, confirmed cases, you are expecting around 92,000 people in the contact list. Because for each confirmed case, we have 40 people in the contact list. Currently, out of this, let's even say 90,000, we just have around 12,000 people in the contact list. This is why one of the consequences you are saying, more than 60 to 70% of new cases are coming from community, are not coming from the contact list. We cannot say we'll have a total understanding of the outbreak, even the control of the outbreak, if we still have cases coming from the community and not from the contact list. This is the major challenge that we have currently.
Our viewers just met Grace Kakure in Mongwala, a nurse who works there. She has lost colleagues, works in an under-equipped hospital where colleagues haven't received hazard pay. This is against the backdrop of attacks on public health teams. Dozens of health workers have already died in this outbreak, as you well know. What is Africa CDC doing to support and protect frontline staff like her?
Yeah, this is a critical question because we cannot afford to have health workers dying during an outbreak because we need them to respond to the outbreak. Unfortunately, we have more than 120 of them already affected, and we lost more than 36 health workers. What it means? It means we, Africa CDC, WHO, and other partners, we need to intensify what we call infection prevention control. We need to equip and nurses and health workers. It was not the case in the beginning. This is when we had so many of them affected and infected. But currently, we increase our capacity to equip health workers, and I think we are protecting them more than it was before.
Doctor, let's turn to treatment. We've seen U.S. Health workers brought here to Germany for novel treatments using antibodies and retroviral drugs. They were helped enormously. 7 current monoclonal antibody therapies transformed treatment for the Zaire strain of Ebola. How significant has this breakthrough been for patient survival and outbreak response with that variant?
You know, it's really unfortunate after 19 years of this Budibungyo virus. It's just now that we are conducting clinical trials to know if there is a treatment. Also, African people, they are seeing what's happening. When there is an American infected, they will send him in Germany to get appropriate care. But, you know, what we are saying is we are learning from that. And we'll continue with our clinical trials. We have 2 drugs that we are combining. And these 2 drugs will give us, in a few weeks, critical information on the efficacy of the treatment. We hope to say to our people in Africa before the end of this year that we find a medicine that can cure Budibungyo. That was not the case in the past. Regarding other solutions that other countries they have, we are talking to them. We are asking for solidarity, and I hope they will understand also our message because it's time for us to work together.
Could candidates such as these monoclonal antibodies mark the beginning of a new generation of broad-spectrum Ebola therapies effective against multiple Ebola species?
Yes, we hope to have, you know, like now for diagnostics, we have platforms that can help us to detect 5 strains at the same time. We are hoping also to have a drug that can help us to respond to Zaire strain, Budibungyo strain, Sudan strain. But for now, we don't have. For now, we are hoping that the monoclonal body that we have and also the remdesivir that we are using to as a clinical trial, we hope that by combining both, we can have a treatment. We will see if this treatment can also respond to other strains.
Dr. Jean Kaseya, appreciate your making time in what I suspect is a busy schedule. Best of luck.
Thank you so much. As you know, I also sent a letter to the US government to lift the travel restriction to Uganda, and I hope, because Uganda did great progress, I hope they will do that. We are counting on that Deutsche Welle for them to listen from this message and to say they have to act.
We'll be watching developments. Thanks again.
Thank you.
To Kenya next, where activists accuse authorities of ignoring a court order that halted the establishment of a US-backed Ebola quarantine facility in the country. Located about 200 kilometers north of Nairobi, the center was designed to receive and quarantine Americans who may have been exposed to the Ebola virus in neighboring DRC. Although Kenya has never recorded an Ebola case, it remains a key U.S. ally in Africa. President William Ruto has defended the planned facility, describing it as part of a broader health partnership between Kenya and the United States. He also revealed plans to set up 24 additional Ebola preparedness centers across the country, funded with U.S. support. The project has sparked strong opposition, with many Kenyans questioning the decision to bring potentially exposed individuals into the country. In the town of Nanyuki, residents have staged a series of protests against the facility. Tensions have escalated in recent weeks, and 2 people were killed after some demonstrations turned violent. Last month, a Kenyan court ordered that the facility should not become operational while legal challenges were ongoing. Shortly afterward, Health Minister Aden Duale directed that construction work be suspended. Despite these directives, activists claim authorities have continued to move the project forward. Our reporter did a straw poll of a dozen people in the streets of Nanyuki. Unsurprisingly, not one of them spoke out in favor. Here's one local lawyer we spoke to right next to the base who gave us a general sense of the public opinion.
And the status so far is that we as citizens are very concerned that despite there being court orders that are existent, the CS held Duale, despite him promising in court that they will stop the further establishment of the quarantine facility in Kenya. We have news that we have 7 patients who have been quarantined here. The other day we saw in the news that the president of Kenya stating that this is a country which is governed by the rule of law. However, the state itself is in contempt of court orders. Currently, as we speak, citizens here are very concerned that if there is a case of an outbreak, and if one resident from Nanyuki is affected, the whole country will come to a total shutdown. Tourism will be affected, the education businesses will be affected, and it's a very, very worrying situation. Once again, the CS is in contempt of the High Court orders, the government is in contempt of the High Court orders. We are in a lawless country as we speak right now.
I'd like to welcome Nora Bagathi, the Executive Director of the Katiba Institute, one of the organizations that took the government to court over continued operation of the base. Nor, do you have hard evidence, documents, eyewitnesses, maybe even satellite imagery that Americans are actually inside that facility, or is your suit still based on Samaritan Purse's own statement?
So we don't have hard evidence that there are people being held at the facility under the agreement. We're very much operating off the public statements that have been made by US officials and the media reporting. Our underlying suit, I should note, isn't about people being held at the facility, but is about the process by which this facility was established. And we moved to contempt once before when the court orders were disrespected and the facility continued being built, and the government apologized for that and promised that they wouldn't do that, would now abide by the court orders. So it's very concerning to us to hear that there are people being held at the facility, but we haven't heard anything from the Kenyan government with that regard.
As you know, 2 protesters in Nanyuki died from gunshot wounds during demonstrations against the facility. Do you hold the government responsible for that? And has anybody been held accountable?
So it is a massive problem, and again, accountability in both those killings and a lot of the killings we're seeing in the context of protests and policing. There hasn't been accountability, and so that is a real problem. It also points to the point which we make in the lawsuit, which is there is a real need and a real desire for public participation and for consultation on this thing. And most importantly, there is a constitutional obligation to engage in that.
You said any individual involved in violating the court order betrayed the public trust. Are you still pursuing individual officials? Who specifically do you believe authorized this?
So again, that is part of the problem with us not having official information around this. We are taking a close look at the reports that do exist, and if it seems that there is the need to go to court over the violation in specific, then we will do that. If there is the need to seek another contempt order, then we will do that. It would be outrageous if that was the case, because again, we've all heard Honorable Douale promise an open court so that the court orders would be respected. But we are still looking into this because we are still operating just with the public reports, and the Kenyan government has not yet pronounced itself.
And that health minister who you just spoke about, Aden Douale, apologized to the judge after being accused of contempt of court. Let's listen.
I have directed the immediate and complete cessation of any intended construction, site preparations, or related activities concerning Laikipia Air Base facility, pending the hearing and determination of the substantive petition or until further orders of this court.
I should mention, he went on to say he remains committed to the full observance of the ruling. So in your opinion, as one of the litigants, is he still showing disregard for the law?
If there are people currently at the facility under the agreement, there is a complete disregard for the law. The court orders are very clear. It is not just about the building and the establishment of the facility. That is, of course, what he responded to in that clip, because that is what the contempt case was about, the continued building of the facility. But the court orders are very clear. No person can be transferred under the agreement to have been exposed to Ebola in order to quarantine at the facility or otherwise. So any movement by the government on this would definitely be a violation.
I want to make something very clear, or get something very clear. As far as Katiba Institute is concerned, what's the problem here? Is it the very specific allegation, the principle of authorities violating a court order, or the idea that the Kenyan government is permitting the quarantining of Ebola-exposed foreign nationals on Kenyan soil?
Yeah, thank you for that question, because our case really actually goes to the heart and substance of constitutional process and the need to follow constitutional process. We need to be able to see the impact assessments, the contingency plans that have been made around this. We need to see that those have actually taken place the way they should. We need to see that Parliament was involved in the way that it should be involved. We need to see that public participation has happened in the way that it should happen. These are all constitutional provisions that are there for a reason. They're not just tick box exercises. They're real processes that protect the people living in Kenya and that protect us should the facility in fact be harmful or pose a risk to the lives of Kenyans. And so our lawsuit is really about process and following the constitutional law. It is not, we are not public health experts. It is not about whether we think the facility is a good idea or not. The process, the constitutional process, should make that very clear.
Nora, assuming that your allegations are in fact true, why do you think the Kenyan government is doing this, defying the rule of law in the country that it governs, by all appearances anyway, at the behest of a foreign power?
So I think there are two things. So the first thing to note is, again, we aren't currently saying that the government is in contempt of this. We haven't filed a contempt motion for the foreign nationals that are supposedly being held at the facility, in part, again, because we're looking into what the facts around this are. And it is quite shocking to us that with those reports having taken place, there still hasn't been an official or public communication from the Kenyan government. But so our case really revolves around the establishment of the facility. The case where we had taken the government to court over contempt, and the government, in fact, was found liable for contempt, was the case where they continued building despite the court orders. And so that goes to the heart again of what does our constitution actually mean? It's not a suggestion, it is mandatory. And so you can't just go around violating court orders and think you can get away with it.
What's at stake if your suit doesn't succeed?
I think that the true constitutional order is at stake with this suit. Again, the Constitution isn't a suggestion, and processes must be followed correctly. The question of public health and how one deals with infectious diseases in a safe manner. Again, that is not something we are experts on, but it is something that many people are experts on. And the reason why the Constitution sets out the law and the process in the way that it does is so that these experts and the people who should be tasked with making this decision and feeding into this decision, including the impacted communities in that area, are able to do so. And so this matter really goes to the heart of protecting our constitutional processes and transparency regulations, not just to the issue of this particular facility.
Noor Bagathi, Executive Director, Katiba Institute, thank you.
Thank you.
We're going to end it there, but please be sure to check out our other stories on dw.com/Africa or on social media. We'll see you next time. Bye for now.